Hello everyone, welcome back to my channel. Do you know what chronic kidney disease is? It's a term that may sound daunting, yet it is a reality for millions of people worldwide. Chronic kidney disease, often abbreviated as CKD, is a long-term condition where the kidneys, those vital organs that filter out waste from our blood, don't work as effectively as they should. But here's the thing, it's not as rare as you might think. In fact, it's quite common, affecting millions of people across the globe. But don't feel alarmed just yet. Knowledge is power, and understanding this condition can help in its early detection and prevent further complications. So let's unravel the mystery of CKD together and shed light on how our kidneys function, what happens when they don't, and what we can do about it. Now that we know what chronic kidney disease is, let's delve into its causes. So, what causes chronic kidney disease? Stepping into the realm of causes, we find that chronic kidney disease, or CKD, typically arises from a trio of culprits. The first of these is diabetes, a condition where your body either doesn't produce enough insulin or can't use it properly. Over time, the high blood sugar levels associated with diabetes can damage your kidneys. When your kidneys are damaged, they can't filter blood like they should, which can lead to CKD. The second major cause is high blood pressure. When your blood pressure is high, your heart has to work extra hard to pump blood through your body. This increased pressure can damage blood vessels, including those in your kidneys, impairing their ability to work effectively. Over time, this can lead to CKD. The third cause to note is certain inherited conditions, such as polycystic kidney disease. This is a genetic disorder that causes numerous cysts to grow in the kidneys. These cysts can slowly replace much of the kidneys, reducing kidney function and leading to kidney failure. Now, it's important to remember that these causes aren't exclusive. They often interact in complex ways. For instance, diabetes and high blood pressure often go hand in hand, each exacerbating the other, creating a vicious cycle of damage. And it's not just these three. Other conditions can also lead to CKD, such as glomerulonephritis, an inflammation of the kidney's filtering units, or interstitial nephritis, an inflammation of the kidney's tubules and surrounding structures. But regardless of the cause, the result is the same. Over time, these factors can harm the kidneys, gradually impairing their ability to filter waste from the blood, balance body fluids, and perform other crucial functions. This slow and steady injury leads to chronic kidney disease. Understanding the causes is the first step, but recognizing the effects of this disease is equally crucial. Let's continue this journey and delve into the effects of CKD in our next segment. But what happens when your kidneys aren't working properly? Well, the effects of chronic kidney disease, or CKD, on the body can be quite profound. Our kidneys are like the body's natural filtration system, working tirelessly to remove waste and excess fluid. When they're not operating at full capacity, these unwanted substances begin to build up, causing a range of distressing symptoms. One of the most common effects of CKD is fatigue. This isn't your regular tiredness, but rather a pervasive, relentless exhaustion. This happens because your kidneys aren't producing enough of a hormone called erythropoietin, or EPO, which stimulates the production of red blood cells. These cells carry oxygen to your muscles, fueling them to do their work. So, when your red blood cell count drops, it's no surprise you're left feeling drained. Swollen ankles are another telltale sign of CKD. When your kidneys can't eliminate excess fluid, it accumulates in your body, often settling in your lower limbs. It's not just uncomfortable. The swelling can make it difficult to move around. Blood in your urine can be a rather alarming symptom of CKD. This happens when the disease damages the tiny filters in your kidneys, allowing red blood cells to seep into your urine. Shortness of breath is another symptom that can be both distressing and limiting. This can occur due to the buildup of fluid in the lungs or because of anemia, both of which are common in CKD. Now, these are just the immediate effects of CKD. Over time, the disease can lead to more serious complications. One of the most concerning is cardiovascular disease. CKD can increase the levels of certain fats in your blood, leading to the hardening of your arteries. This puts a strain on your heart, raising your risk of heart disease and stroke. The effects of chronic kidney disease are certainly far-reaching and can drastically impact your quality of life. But remember, these symptoms are your body's way of sounding an alarm. They're signaling that something isn't quite right. Knowing the symptoms can help us recognize the disease, but how is it diagnosed? Well, stay tuned to find out. How can we diagnose chronic kidney disease, you may wonder? Well, it's not as daunting as it sounds. Let's break it down together. The diagnosis of chronic kidney disease, or CKD, involves a series of tests that help medical professionals assess the extent of kidney damage and determine the most effective treatment strategy. We start with a simple blood test. This test measures the level of creatinine in your blood. Creatinine is a waste product that your kidneys should filter out. If the kidneys aren't functioning properly, the creatinine level in your blood will rise. This test gives doctors an idea of how well your kidneys are filtering out waste. Next up, we have the urine test. This test checks for protein in your urine, a condition known as proteinuria. Healthy kidneys should keep proteins in the body, so finding proteins in your urine can be a sign of kidney damage. This test can also detect the presence of red and white blood cells, which could indicate a problem. Now let's talk about imaging tests. These include ultrasounds or CT scans. These tests provide images of the kidneys, which can show any physical changes such as size or structural abnormalities. Sometimes, a kidney biopsy may also be needed. This procedure involves taking a small sample of kidney tissue for laboratory testing. It can help determine the exact type of kidney disease and the extent of the damage. These tests, when considered together, paint a comprehensive picture of what's going on inside your body. They enable doctors to accurately diagnose chronic kidney disease and map out the best course of action for each individual patient. Remember, early detection is key. If you have any risk factors or symptoms of CKD, don't hesitate to seek medical advice. These tests are routine, non-invasive, and can save you from severe complications down the line. Diagnosis is the first step towards treatment, so how can we treat chronic kidney disease? Stay tuned to find out. What are the options for treating chronic kidney disease? You may wonder. Well, let's dive right into it. Treatment for chronic kidney disease, or CKD, is primarily focused on slowing down the progression of the disease, managing symptoms, and addressing complications. The choice of treatment largely depends on the stage of the disease and other individual factors. Firstly, lifestyle changes play a crucial role in the treatment of CKD. This includes maintaining a healthy diet, limiting alcohol, quitting smoking, and incorporating regular exercise into your daily routine. These changes can help control high blood pressure and high cholesterol, two key factors that can worsen kidney damage. Medication is another common treatment option. There are various types of medications available, each targeting different aspects of the disease. For instance, some medicines are used to control high blood pressure, while others help lower cholesterol levels, control blood glucose, and treat anemia. In more advanced stages of CKD, when the kidneys are severely damaged, dialysis may be required. Dialysis is a procedure that artificially does what healthy kidneys would do: remove waste, extra salt, and water from your body, regulate blood pressure, and keep the body's electrolytes in balance. There are two types of dialysis: hemodialysis and peritoneal dialysis, each with its own pros and cons. Lastly, a kidney transplant can be a viable option for some individuals. This involves replacing the diseased kidney with a healthy one from a donor. While a transplant can significantly improve quality of life, it's not without risks and requires lifelong care. In conclusion, treatment for chronic kidney disease is multifaceted and tailored to each individual's unique needs. It's crucial to work closely with your healthcare team to determine the best course of action for you. Remember, early detection and treatment can make a huge difference. So, make sure to schedule regular checkups with your doctor and take good care of your health. After all, your kidneys are working hard for you. It's only fair that you do the same for them. Knowledge is the first step towards prevention and treatment. And with that, we've come full circle in our exploration of chronic kidney disease. We've journeyed through its causes, understanding how things like diabetes and high blood pressure can trigger it. We've delved into the symptoms and effects, recognizing the subtle warnings our bodies might give us. We've seen how medical professionals diagnose it, using various tests and procedures. And finally, we've discussed the available treatments, from lifestyle changes to dialysis and transplantation. A key takeaway? Regular checkups. Early detection can make a world of difference. It's not just about treating the disease, but enhancing the quality of your life too. Thank you for joining me on this journey. If you enjoyed this video, don't forget to give it a thumbs up, subscribe and leave a comment below, and hit the bell for more health and wellness inspiration. Until next time, stay healthy and happy.